Hello and thank you so much for joining us, whether you're watching on television or online. I'm Anthony Robart. We are waiting for the latest update from Prime Minister Justin Trudeau. That is expected in about 15 minutes. He will walk out of his home in Rideau Cottage in Ottawa, where he's been working from home in self-isolation for several weeks now, in fact. So while we wait, let's look at the latest numbers from here in Canada and around the world. Let's look globally first of all. And there are now close to 1.5 million confirmed cases of coronavirus around the world. More than 400,000 of those in the United States. That works out to more than Spain, Italy, and France combined. In Canada, more than 18,000 people have tested positive. So here is where the numbers in our country's hardest hit provinces stand today. The number of confirmed cases in Quebec jumped by almost 1,000 in a span of 24 hours as it approaches the 10,000 mark. In Ontario, there are now more than 5,200 cases as criticism grows over an apparent lack of testing. Further west, Alberta is now reporting more than 1,300 infections after reporting only 25 new confirmed cases on Tuesday. BC now has close to 1,300 confirmed cases. Now, across Canada, a number that no one wants to hear, more than 380 people have died. Well, the Premier of Alberta has unveiled COVID-19 projections for that province, saying 1 in 6 Albertans could contract the virus. In a televised address last night, Jason Kenney said Alberta could see between 400 and 3,100 deaths by the end of the summer. He is anticipating a peak of coronavirus infections in mid-May, so some time to come before that. Despite these numbers, the Premier is saying the outcome, of course, depends on how well people adhere to physical distancing. In total, Alberta is bracing for about 800,000 cases of COVID-19. Now, Quebec also releasing its modeling projections, public health officials outlining the best and worst case scenarios. At best, the province is bracing for nearly 1,300 COVID-19 deaths by the end of April. The worst case scenario predicts a death toll nearly 7 times that at more than 8,800 fatalities. Premier François Legault says Quebec could be close to reaching its peak, but warns the battle is far from over. Incidentally, Saskatchewan and Newfoundland are expected to release their projections later today. Let's bring in Mike LeCouture, who is standing by in the nation's capital, to give us a preview of what we can expect from the Prime Minister today. What are you hearing, Mike?
Yeah, Anthony, we're hearing that he will speak about a bit of a retooled summer jobs program, specifically aimed at helping students find work in those industries that haven't shut down due to COVID-19. He has been speaking about that in recent days, saying how, look, if you are a student that you thought you were going to have a job in a different industry, consider other industries potentially that are still remaining open. That was specifically to the agricultural industry, where temporary foreign workers are not flowing over the border as quickly as they have in the past. So he's saying maybe that is an option, but obviously cognizant that they're looking ahead to the summer and where people are applying and where jobs are needed and where people are needed to fill those jobs. The other thing we're expected is a retooling of the emergency subsidy, the wage subsidy program. There's a lot of criticism from companies over the last couple of days saying there were a number of gaps. We're hearing reports that there will be some filling in of the gaps, or at least retooling some of those things. Part of the legislation that is attached to that was sent yesterday to the opposition parties, so you can expect some of that to be considered and possibly an announcement there. We're also getting the updated numbers of the CERB, that Canada Emergency Response Benefit. So yesterday we had the opening for people with birth months of April, May, and June. The numbers that we are seeing is a total of over 750,000 Canadians applied for it yesterday. To date, week to date, we have 1.72 million Canadians that have applied for it, and the number of CERB applications that have been received since March 15th, get this, 4.26 million. In terms of process claims since March 15th, because don't forget, if you had applied for EI after March 15th, you were automatically put into that CERB, that stream, and making sure that you get that money from there. Process claims, 3.87 million Canadians are going to be getting money. We're also getting some emails from viewers. Some of our producers are saying that they are hearing that people are getting checks already. Some of them, unfortunately, say that they might be getting double checks. They're unsure sure how they should proceed with that. So don't forget, at the beginning of all this, everybody said speed over perfection. We may be seeing the fallout from this now, that it is not going to be perfect. So if the Phoenix pay system is any indication or any sort of precursor to what we may be dealing with here, maybe hold on to those checks. Don't cash them just yet. They have been deposited into your account for sure, but make sure you don't spend all of it in case the government comes back and says we may have made a miscalculation. But just keep track of it to people out there who may have amounts in their accounts right now and aren't exactly sure what to do with it, Anthony. So it looks like money is going out the door already. It's in people's accounts. And considering how much they've had to process, it may not be a perfect system just yet.
Well, I mean, some positive news as you highlight, but I mean, it's going to take a long time, especially when you look at how many people are waiting for that money. I want to shift real quick to the shortage or the expected shortage of PPE for the frontline workers in this country. And really this highlighted by some of the problems in Toronto. They received a number of masks that were considered defective, obviously compounding an already difficult situation. What more do we know on that?
Yeah, over 60,000 masks, and they were distributed to long-term care facilities, the places where the need is the most acute, obviously, because we're seeing a lot of those outbreaks in those long-term care facilities. So yesterday, that report from the City of Toronto noticing that they were tearing and there were other defects in some of these masks. They had to recall those, and now obviously trying to replace them. So that's a difficult situation. Again, speed, over perfection doesn't really work the best there. And that is one of the concerns. And of course, the PPEs, yesterday, the Prime Minister saying, look, we are ramping up with industry and making sure that we have industry on board. Speaking yesterday to Starfish Medical, one of the companies that is helping to make the Winnipeg ventilator, which Toronto viewers might remember, was one of those ventilators that was used in the SARS outbreak, and so that is going to be retooled, remanufactured. And yesterday, speaking to the CEO of Starfish Medical, he basically said, look, we're going to go through all of our clinical trials and regulatory issues in the month of May, and we're hoping to ramp up and do 1,000 of these ventilators per week when we can finally get it going, and that might be only as early as June, Anthony.
Well, certainly going to help, but it's going to take some time, and people need that help right now. All right, Mike, we'll leave it there for now. Thank you so much, Michael Couture from Ottawa. And still in Ottawa, if you're just joining us, there you see a live shot of the door at Rideau Cottage. We're waiting for the Prime Minister's address. That is coming up in about 12, 13 minutes, give or take. Let's head out west to British Columbia, where Richard Zussman is standing by in the provincial capital. Richard, thank you so much for joining us. Now, when you look at the numbers across the country, we set it up. Obviously not good cases in many provinces. BC, interestingly, seems to be bucking the trend. Why do you think that is?
Anthony, there are a number of factors here, and cautious optimism is the word we keep hearing from Chief Medical Health Officer Dr. Bonnie Henry. We have now seen a number of days in a row where the new case number has not been as high as it has been in the past. We've seen a decrease in the number of people in hospital. We've seen a decrease in the number of people in the ICU at those hospitals. A few different things here. Dr. Bonnie Henry contributes part of it to the fact that BC put in strict measures sooner than most provinces in the country, and that has led to these positive signs. And the other factor as well is that March break here in British Columbia was a week later than in Ontario and Quebec. So when Ontario and Quebec started seeing people return from down south, the caseload started to go up. Here in British Columbia, we didn't see that same trend because a lot of people had not left yet for March break, and those vacations got cancelled. And so a little bit of good planning, a little bit of good luck, but British Columbia continues to lead the way here in terms of bending that curve, but we are far from getting out of the woods. There are still a lot of concerns about the people that are still in hospital, as well as potentially these case numbers going up again.
So bending the curve, obviously some good news, but I guess, officials are warning everyone not to take your foot off the gas pedal, because you look outside, as you know, the weather is nice. It's nice today and it's expected to be pretty nice in the days to come. So, talk about the physical distancing regulations, whether people would adhere to these rules. Talk about some of that if you could.
Yeah, one of the worries, Anthony, is with the warmer weather coming, it's expected to be in the low to mid-teens in terms of temperature and sunny all weekend long in many parts of British Columbia. And you can tell from what we've heard from the officials over the last few days, they are very worried about British Columbians going out and enjoying that sunshine and potentially, going back on all the good work that has been done in terms of staying at home and social distancing. So a few measures have been put in place. One of those is just announced BC parks will be closing immediately all of the parks across the province. There's also a big push for people, do not go to your cabins and cottages in more remote areas. Those areas just can't handle potential pressures on the healthcare system. So people are being reminded, do not go out and enjoy like things are normal, because things are not normal. The last thing too, the province continues to push Ottawa to tighten up those rules around the Quarantine Act. My understanding is we may get word on that today, that BC wants the federal government to better communicate at the airports and land crossings in terms of ensuring that people go into isolation for 14 days as soon as they return to Canada.
All right, good reminders for everyone. Richard, thank you so much. Richard Zussman from Victoria. All right, looking overseas now, a story we've been following very closely. British Prime Minister Boris Johnson remains in intensive care today, battling COVID-19. Officials say he is responding well to treatment. Johnson, we're told, is in stable condition. Not a lot coming out of his condition, however. He is receiving oxygen, but is breathing on his own. Obviously, some good news there. Foreign Secretary Dominic Raab is sitting in for the PM until he recovers. And there you see a live shot at Rideau Cottage. We are awaiting still the Prime Minister that is expected in just a few minutes. So let's bring in Mercedes Stevenson, our Ottawa Bureau Chief, who's been covering this extensively from the beginning. And Mercedes, we talked about the projections that came out of Alberta. The numbers, not good news there. And also not good when it comes to the numbers of cases, but also when it comes to the economy and the projected unemployment numbers. Shed some light on that if you could.
Yeah, Anthony, Alberta was already a province that was really struggling, and they're looking at the possibility of their unemployment rate absolutely skyrocketing. And there still hasn't been word yet as to whether or not the federal government will bail out the oil sector. There was sort of some early talk about it. The Prime Minister has been asked about it a few times. They're obviously in the process of rolling out a lot of programs, but you're hearing now from people in Alberta who are saying, look, it's been weeks. Some people there are saying that they want the industry bailed out. Certainly, Premier Jason Kenney would like to see the federal government put some money towards that. On the other hand, there's other sectors in Alberta too that are really hurting, because when the vast majority of the income comes from oil and it is at this tremendously low price, it affects government revenues. It affects other industries that support the oil industry. The tech industry there is frustrated with Premier Kenney because they're saying that all the attention and money that he's pouring in at a provincial level are going towards the oil and gas sector, and that they're worried that their sectors are not going to get the attention they need. The government there as well has laid some people off. So there's a lot of tension right now out in Alberta from people there who are feeling forgotten on two levels, and no indication as of yet if or when the federal government is going to act and do something unique for Alberta, or if they're going to leave it at the same programs that are available to all Canadians in terms of the CERB and the wage supplement.
Yeah, the number we see on the screen, the banner is 25% unemployment projected for Alberta. Just looking at the oil price, a little more than $24 US, obviously a very low number. When you put in context that the Alberta government projected, or at least budgeted, for $53 a barrel. So that changes everything. And as you mentioned, they went into this in obviously a difficult situation. Also a difficult situation for, businesses across the country. One of the biggest, Air Canada. And we're hearing some rehiring of the thousands of people that were laid off through this government program. What do we know about that?
That's right. So I'm just bringing up my computer to get the exact number here for you, Anthony. 16,000 people are going to be rehired by Air Canada using the wage subsidy program that the federal government has announced. Remember that initially that wage subsidy was only 10%. It then jumped to 75% for small and medium-sized businesses. Then they expanded it to all businesses. And there was a lot of speculation that part of that had to do with the fact that big companies like Air Canada were not going to be eligible, and that you could see quite literally tens of thousands, hundreds of thousands of people laid off from those kind of big big companies overall. So obviously good news today for 16,000 people who will be rehired back to Air Canada using this new federal wage subsidy program. And we think we may be hearing some updates on exactly what that program looks like as well. Not to mention the loans for businesses. That's something that the business community have been flagging, saying, you know, the bar of having to have lost 30% of income or revenue was simply too high, and that most businesses would be unable to survive at that point. Even if they could pay their employees wages, they would not be able to pay their capital costs. They would not be able to pay their rent. They would not be able to pay their suppliers for materials that they need. So we're going to keep a close eye on that. We know that Bill Morneau is going to be speaking later today, the finance minister, and Mary Ng, who's in charge of international trade for small businesses. So we're going to have a listen to what they have to say. It's certainly a program that the federal government is still tweaking, just like the CERB. They're announcing these programs to try to get them rolling out as quickly as they can. And then sort of as these holes pop up in them after the fact, they're going back and patching it up or changing rules to try to adapt them to reflect what's needed.
Yeah, one more note about Air Canada. I was just reading that the CEO, Kaylin Rovanescu, and the CFO, Michael Rousseau, are giving back their salary. And looking at the number for Mr. Rovanescu, $11.5 million that he made last year. So at least a sign of good faith on that front. We have about a minute before the Prime Minister is expected, if not less. So I want to keep this pretty brief. But, the finance critic for the Conservative Party spoke about an hour ago talking about some of the measures that, he's pressuring, or his party is pressuring on the government, GST, one of them, to pay back 12 months. Is there any sign that that could be something that the government's going to look at? Also, as you mentioned, sort of expanding the wage subsidy, because a lot of people, a lot of businesses don't necessarily apply. 30% of the revenue that you'd have to lose is significant.
Yeah, and one of the suggestions has been that GST rebates would help with that. Now, the government has deferred GST payments. They could go further than that, obviously. I'm sure that that's one of the options that they're looking at. Whether or not it'll be an option they take, we'll have to wait and see. But that's certainly been suggested as one way that would help if people were able to get some of that money back or not have to pay it down this year. Then, especially for some companies, GST is a significant percentage of their income that they're paying back to the government. If they don't have to do that, what it effectively would
Mercedes,
do
I'm going to have to jump in there.
Is work like a
Prime Minister Trudeau is just about to speak.
Happy International Day of Pink. Today we wear pink to stand up to bullying and support those facing discrimination. If you feel alone, if you're anxious or scared, know that we're here with you today and every day. Now, I want to begin this morning by addressing Canada's Jewish community. Tonight at sundown marks the beginning of Passover. Usually, this is a time for family and friends to gather around the Seder table. But tonight will truly not be like all other nights. I know staying in tonight and not gathering extended family will be hard, but it's the best way to keep yourselves and your loved ones safe. I hope you still find a way to connect with family and friends, whether it be on the phone or through video chat. To all those celebrating Passover, Chag Pesach Sameach. Over the past few weeks, we've all had to make changes because of this pandemic. Staying indoors as much as possible and not seeing friends and family is a big adjustment for everyone, but it's especially hard for some people. If you've lost your job, if you work in an industry that's been hit hard by this virus, you're worried about your family and your future. What makes the situation so difficult is how quickly it all happened. Through no fault of your own, your whole world has been turned upside down in a matter of weeks, and that can create even more uncertainty and even more anxiety. So we've brought in a whole range of new measures to help families and workers, seniors and business owners get through this. We've put in place a 3-point economic plan. It supports business owners, including through new loans, while helping those who no longer have a paycheck through the CERB, and protecting jobs with the Canada Emergency Wage Subsidy. I know many of you are anxious to see this subsidy delivered. We're calling on the opposition to join us in bringing the House back to pass legislation so you can get the support you need as soon as possible. Cabinet will be meeting this afternoon. As usual, most cabinet members will be on the phone, and I will be attending this one in person to discuss next steps. Depuis qu'on a annoncé la subvention salariale,
Ever since we've announced the wage subsidy, we've had many conversations with business owners, unions, and workers. I would like to thank them for their advice and their perspectives. These conversations have helped us to adapt what was announced to include a greater number of businesses and to help out more people. And this is what I would like to speak to today. We had said that businesses had to demonstrate that their revenue had gone down by 30% this month compared to the prior year in order to receive the subsidy. We recognize that for charitable organizations and startups and new businesses, this can create a problem. So we are going to be more flexible. Businesses will be able to show a reduction of 15% of their revenue for March rather than 30% in order to take into account the fact that, generally speaking, the pandemic had an impact on their activities as of mid-March. Businesses also will be able to choose to use January and February as a reference period to show that there was a loss of revenue. As for charitable organizations and NGOs, we know that you have different challenges with regards to funding. For this reason, you will have the choice. You can include or exclude government subsidies when you calculate your loss of revenue. If your business has been affected by COVID-19, the government will give you up to $847 a week for each employee. And, as was announced, this subsidy will be retroactive to March 15th.
Since we announced the Canada Emergency Wage Subsidy, we've had a number of conversations with stakeholders and workers who've provided us with valuable feedback and helped us refine what we'd put forward. I want to thank them for their input. We want to make these emergency measures as effective and inclusive as we can, so we're listening and making adjustments along the way. We previously announced that to qualify for the subsidy, businesses would have to show a 30% drop in revenues when comparing the month this year to the month the previous year. We recognize that this could be an issue for nonprofits, fast-growing companies like startups, and new businesses, so we're going to put in place more flexible rules. Companies will now have the option of using January and February of this year as reference points to show a 30% loss. And businesses will only need to show a 15% decline in revenue for March instead of 30%, because most of us only felt the impact of COVID-19 about halfway through the month. We understand that charities and nonprofits are experiencing different types of pressures when it comes to funding. For this reason, they will have the choice to include or exclude government funding when calculating loss in revenue. If your company or organization has been impacted by COVID-19, the government will give you up to $847 a week per employee. And as we've said before, this subsidy will be retroactive to March 15th. Our government understands that not all businesses operate the same way, and that's why we're making changes to include as many of you as possible. We will keep listening, but we really hope you will use this help from your country and from your fellow citizens to rehire and pay your workers. If our economy is to get through this, we need businesses to survive and workers to get paid. Job numbers for March will be out tomorrow, and it's going to be a hard day for the country. We're facing a unique challenge, but I know that if we pull together, our economy will come roaring back after this crisis.
Over the past few weeks, we've implemented unprecedented measures. The emergency wage subsidy and the Canada Emergency Response Benefit to help out workers, businesses, and families. This being said, some people are not eligible to these benefits, and others need more support. I'm thinking, for example, of freelancers, of home care workers, and those who have seen reduced a reduction of work hours to 10 hours or less. We're working on solutions, and we will provide help. Our seniors are also going through hard times because they are particularly vulnerable in the face of COVID-19. They're also concerned of the impact on their savings. We will have extra measures to help out our most vulnerable seniors very soon. As for students, there are students who are getting ready to find a job, and we will have several measures to support you as well. This morning, we're going to begin with the first step.
Affected by COVID-19, we're making changes to the Canada Summer Jobs program this year. We will now give CSJ employers a subsidy of up to 100% to cover the costs of hiring students. We will also extend the time frame for job placement until the winter, because we know that some jobs will start later than usual. And because many businesses have had to scale back their operations, they will be able to hire students part-time. Our government is also encouraging all employers who have been impacted by COVID-19 to make adjustments so work can continue. For example, if you run a local food bank, you may be doing deliveries instead of serving people on site, so you could hire students to help you. We will also be asking MPs across the country to reach out to businesses and organizations providing critical services in their communities to look at how students can help during this critical time. In this economic climate, it's hard for people of all ages to find work, but young people are especially vulnerable. They're new to the workforce, so they don't have a lot of money set aside for this kind of situation. At the same time, they need work experience to secure their next job and money to cover their living expenses and help with tuition for the rest of the year. Today, we're taking a step in the right direction to help young people find work during this difficult time, but I want to be clear, we will be doing more. Just like we will do more for those who need help but are not eligible to receive the benefits we've announced so far. We're also working around the clock to ensure that our frontline workers have everything they need to save lives and stay safe. Overnight, we received 500,000 N95 masks from 3M, and they'll be distributed across the country where they are most needed. I know the past weeks haven't been easy, but we're going to get through this together if everyone keeps following the instructions from public health experts. So please, stay home as much as possible. Only go out for essential things like groceries and medications, and try to make that trip once a week or less. And when you do, remember to keep 2 meters from those around you. That's the best way to stay healthy and protect our frontline workers who are doing so much to help all of us. Encore une fois, merci d'être avec nous ce matin.
Once again, thank you for coming this morning. I will now answer questions.
One question, one follow-up. Over to you, operator.
Merci, thank you. The first question is from Heather Schofield from the Toronto Star. Your line is open. Please go ahead.
Good morning, Prime Minister. Could you talk to us about what your plan is to get people back to work efficiently and safely without provoking another outbreak?
What we're seeing around the world is countries are beginning, as we see social distancing measures, as we see people staying home in countries around the world, are now looking at the steps needed to think about easing those social distancing rules to start our economies rolling again. It is very obvious that we need to be very, very careful that all the work we've done over these past weeks and in the coming weeks at staying home, at following the instructions of our public health officials, doesn't become for naught when suddenly spikes happen as we get back to work. So it's going to be very, very important to do it in a measured, graduated way that allows for economic activity to begin while preventing severe spikes in COVID transmission. There is a lot of reflections ongoing on that, but as we know, the current measures will be in place for many more weeks, so we have time to get that right and to look what other countries that might be earlier in their phase do that is successful or less.
And just to follow up on that, I mean, it seems that we do have some time to think about it, but there's also, how do you assess the risk of summertime? I mean, we've been cooped up already for for 4 weeks, and people are doing it voluntarily, and as you say, working very well together. But what's the risk of that falling apart as the summertime comes and the good weather is there and people are, in desperate need of some earnings as well?
We will be talking about modeling in the coming days and what various scenarios are. But what is very, very clear is in order to avoid spiking cases, in order to avoid having to stay in reduced economic activity modes for months and months and months and months and months, we need to keep very, very strong in the measures we have now. That is how we get to the best case scenario. And quite frankly, the social distancing and the staying home that Canadians are doing now is exactly the right kinds of things that we need in order to look at the most optimistic models. There is no question that once we start to get to the other side of this spike and are able to talk about easing off social distancing, there will be a need for continual surveillance, continual attentiveness on testing, on contact tracing, on protecting our most vulnerable. That means even as things are able to start getting back to normal, they won't be back to normal. And calibrating that right and understanding that what people are doing now is essential, what they will continue doing now is just as, in the coming weeks, is just as essential, but how we ease off and continue to follow the best directions and instructions of our public health officials will be how we manage to get through this in the best possible way.
Nous reconnaissons que c'est difficile.
We recognize that it's very difficult to stay in isolation, to stay home during this period of time. And we know that we are going to have to continue doing this for several weeks to come. But to have the best opportunity of getting out of this as soon as possible, we have to continue with these measures that keep us safe. At some point, in a few months, most likely, when we will be looking at easing up on these measures, to a certain extent, we will still have to be very vigilant with regards to our behavior as to who can return to work, to make sure that we're not facing a new spiking of cases, or even worse, that we undo all the work that we've done over these past few weeks and that we find ourselves with a huge number of cases in the country. We are following this closely. We're trying to see how we can go to the next phase. But right now, we are very, very entrenched in this current phase. It means that we're going to stay at home as much as possible. We're going to continue keeping social distance measures in place.
Merci, thank you. The next question is from Althea Raj, HuffPost Canada. Your line is open. Please go ahead.
Thank you. Good morning. Can you explain why the government chose not to make relief payments simple, inclusive, and universal? We're hearing from a lot of people who are excluded from the measures that you've announced, including the ones this week for a variety of reasons. Now, one of your MPs is telling people who have some income not to take the attestation for the Canada Emergency Relief Benefit so literally. There's another expert telling self-employed workers not to invoice for 14 days in order to qualify, which to me sounds pretty unethical. Why did you decide against, for example, sending $2,000 payments to all Canadians and to claw them back from those who don't need them next year?
We recognize that we needed to do things quickly, and we needed to do things robustly in a way that would allow our extraordinary public servants at Canada Revenue Agency and elsewhere to be able to put in a system that would reach the largest number of Canadians who needed it as possible. We looked at many different designs, and we even iterated in the designs that we put forward, but we established that the Canada Emergency Response Benefit was a way of replacing income to the largest number of people who suddenly found themselves without a paycheck, and that the wage subsidy at 75% was going to be able to keep people connected to their jobs and ensure that businesses continued to exist so that they can come back quickly afterwards. We recognize that any time you put out large measures quickly and in a way that is solid enough to be certain that it's going to work through the machine, there are going to be gaps. And what we've talked about over these past days is ways of filling those gaps and making sure that more people who are in exceptional or different circumstances are able to access the help we need, and we will continue to have more to say on that in the coming days. Okay. Quand nous voulons aider le plus grand nombre de gens possible, le plus rapidement possible.
We're trying to help the greatest amount of people as quickly as possible, so it is necessary to take very broad measures and to have very robust systems in place. We need to be able to deliver these benefits to a large number of people as quickly as possible. This is a system that was not created to do that, not on such a large scale and at this speed. So these are choices that we've had to make with regards to the benefit, with regards also to the wage subsidy. We recognize that there are some people, even if millions of people will receive the benefits, there are some people who will not be eligible. That is why we are constantly looking at these exceptions to try to find means to provide the necessary assistance. We recognize that it's impossible to have a perfect system in this type of unprecedented situation. We're not aiming for perfection. We're trying to help as many people as possible, as quickly as possible, and that's why we're always making new announcements to try to add new people.
The widest number of people to make this as broad as possible, and you're defending it by saying that you needed to have big, bold action. Wouldn't the big, bold action be to send everybody help as opposed to rolling out week by week new changes, revised versions of programs in order to fix the gaps that apparently are just coming to the government's attention? That way you wouldn't have people who maybe, 6, 7, 8 weeks without any income at all?
We knew from the very beginning that we had to make a choice, whether we get big programs out quickly to as many people as possible, or else we figure out how to refine them and get the right things to people. We made it a double process, a two-program process writ large, where yes, millions of Canadians will receive the $2,000 every month with the Canada Emergency Response Benefit. But we also know that there are many Canadians who are middle class, for whom $2,000 a month might not be even nearly enough to cover their needs right now because of various costs, because of various issues that they're facing, which is why we wanted to bring in a 75% wage subsidy that will give them, instead of just $500 a week, up to $847 a week. That is more generous for people who need it, but it is still a significant pay cut for everyone. We understand this is a situation that is difficult for everyone. We modeled ourselves these programs on a collection of programs that worked in different ways in different countries, and we're confident that we came up with the right measures to help most Canadians. But as I said, there are people we recognize need particular help or don't quite fall into those categories, and that's very much what we're working on now and have been announcing over the past few days in terms of measures that we're bringing in for people who work less than 10 hours a week, for example, who will still qualify for the CERB. These are the kinds of things we're continuing to work on.
Thank you. Next question, operator.
Thank you, merci. La prochaine question est d'Émilie Bergeron de l'agence QMI. Votre ligne est ouverte. À vous la parole.
Oui, bonjour, Monsieur Trudeau.
Hello, Mr. Trudeau. With regards to the wage subsidy, you're talking about a 3 to 6 week waiting period, and this doesn't seem to have changed. Many businesses find that this is too long to wait. What do you have to say to them? We are working extremely hard to try to shorten these delays. We are aiming for 3 weeks. We hope that we'll be able to provide the money in 3 weeks. Of course, we have civil servants that are working tirelessly to deliver the Canada Emergency Response Benefit. Today, we've seen millions of Canadians who are receiving the benefit. This has been unprecedented work done by people who are facing the same pandemic, and they're working for their community, and they have been able to pull out all stops to deliver this benefit. And now they're looking at the wage subsidy. We're trying to aim a 3-week delivery period, maybe earlier if things go well. But we understand that all of these are new. We've never done these. We've never had to do these types of things, so we hope to be able to deliver soon.
This is a significant task, but we know that businesses who are making decisions to rehire are stretched thin and need to know that money is going to come in soon from the government. That's why we are aiming for 3 weeks in terms of landing the wage subsidy, getting it to Canadian businesses. It will require continued Herculean efforts by our public servants, particularly the Canada Revenue Agency, who have done extraordinary work over these past weeks to deliver the Canada Emergency Response Benefit. And as we've seen, millions of Canadians are beginning to receive that as of today. This was an unbelievable effort by people who, quite frankly, are facing the same challenges, the same pandemic, the same family issues and worries that the rest of us are facing, but stayed focused on delivering help for Canadians because this was so important at this time. And now they are going to turn their energies and efforts towards delivering the wage subsidy, which, as I said, we hope to see within the next 3 weeks. But that is something that we're going to continue working on extremely hard. And that's one of the reasons why we are so eager to see Parliament pass the legislation necessary, and I'm certainly hoping that the opposition parties will join me in moving quickly to get this through so we can get help to Canadians.
And suivi.
With regards to the return to the House of Commons, you said that this wage subsidy needed to be passed in the House. What's being said with the opposition parties with regards to this temporary return to Parliament? We're speaking about measures. This is a measure that will be the largest measure in the history of the Government of Canada. We need to have the involvement of the opposition parties in order to pass this legislation. It's also required to study the legislation and to make sure that this is the correct way to help Canadians. If they have questions, of course they have questions, and we're working with them. We hope to work collaboratively with the other parties. In the end, this is help to Canadians. Everyone is in agreement that we have to provide help, and we're working together to find the best way to do this.
We recognize that these measures are the largest measures passed in decades, if not ever, by a Canadian government. That's why our democratic institutions and their democratic processes, including parliamentary oversight, is extremely important. That's why we're working with opposition parties to ensure that this legislation gets passed quickly but properly so that we can get this help to Canadians in the best possible way.
Thank you. One more call, please, operator.
Next question is from Brett Forrester, APTN. Your line is open. Please go ahead.
Hi, Mr. Prime Minister. With various First Nations calling for military assistance, at what point does the military agree to go help? Is it number of cases? Is it deaths? Is it per capita? What's the threshold for answering some of these calls for help?
Obviously, we are very concerned with the situation in First Nations communities across the country. Indigenous communities in general, particularly remote and northern ones, are more vulnerable because they often have difficult circumstances, including difficulty around healthcare. So we recognize that is something we need to focus on. Decisions on how to best help. First of all, we've already allocated millions of dollars to community support programs in Indigenous communities. As for further assistance or military assistance, that will always be made on a case-by-case basis, depending on the individual circumstances and how we can best help as a government. That is what we're always going to be looking at.
And a follow-up?
Yep, thank you. As a follow-up, we know, as you say, these communities really are petri dishes. And for example, Yabamatong and the Anishinaabe Nation Grand Chief have been asking for other resources in lieu of military aid. What's your response to some of their calls to action?
My response to Grand Chief Fiddler and others is really to make sure that yes, we're there and we want to help. I know Minister Miller and others have been engaging directly with leadership across Canada to ensure that what is needed is worked on together. We recognize the particular and in some cases significant needs of, in many cases, significant needs of Indigenous communities, and that is something that we are working on together.
We recognize that our Indigenous communities are vulnerable to COVID-19. This is why we continue to work with them. We have made direct investments to these communities already. We should do more. We will do more. We are working with the leadership. Minister Miller and others are working directly with communities to make sure that they have the necessary equipment to prevent COVID-19 and to help if there are cases. Mr. Trudeau, you said that your benefit program is not perfect. Why isn't it more simple? Why did you not decide to send a check to everyone and ask for a reimbursement? Why didn't you make it more simple so that people right now would have money and no would fall between the cracks? A lot of people are not eligible for EI. There are many systems that we looked at. We looked at different ways to help people, and we decided that the Canada Emergency Response Benefit was the best way to help millions of people. As we said, we recognize that there are some people who are working only a few hours a week, and they should have access to this benefit, and we are making the necessary changes. We also recognize that there are people in different situations, such as students. They are facing real challenges to find summer employment, to find part-time employment, and they need money to pay their rent and to be able to go back to their studies in the fall. That is why we are always looking at other ways to help. But the Canada Emergency Response Benefit and the wage subsidy together will help out millions and millions of Canadians, of Canadian workers, of people who are going through hard times. We're going to continue to work to help the most vulnerable as well.
We recognize that the two measures we've put forward, the wage subsidy and the Canada Emergency Response Benefit, will help millions of Canadians. But at the same time, we also recognize there are people who will not qualify for either and who need help. That's why we've announced certain modifications already. If you're working less than 10 hours a week, we will be telling you how you can apply for the CERB. If you're a student, for example, on top of the Canada Summer Jobs Program that we talked about today, we will bring forward more measures because we recognize that without your summer job, without a source of income over the coming months, including part-time work, you will have trouble paying your rent. You will have trouble paying for your tuition next year. So these are the things that we're continuing to work on. We just needed to get the two big measures that would help millions of Canadians out as quickly as possible and chose to work on refining them later. There is always a fundamental choice to make in a crisis around whether you want to move fast or whether you want to get everything absolutely perfect. In this case, we understood that getting help out to Canadians as quickly as possible in a way that is as solid as possible was extremely important, and we continually work in terms of making sure we're getting people who find themselves in gaps.
Mais vous dites, Monsieur Trudeau, que vous voulez que ça soit rapide.
You say that you want this to be quick. So why is it not more quick for those who are qualified for the CERB and others for the wage subsidy? Is going to take still a few weeks. And so you're going back to the House of Commons. Are you done with working at home? I'm going to continue working at home. I will stay at home for most things. But now, from time to time, for strategic or important meetings, I will go to the Parliament of Canada to work. But generally speaking, I will be working from home.
I will continue to work from home day in and day out, as we're asking most Canadians to do. There will be moments for strategic meetings or particular issues where I will go into the office for meetings, taking all proper precautions, but most of my work will continue to be from home on the telephone.
Marika Walsh with the Globe and Mail. For the past 2 weeks, you've been saying that the models that Canada will release are coming in the coming days. When will they actually be released?
We've seen over the past few days a number of provinces putting forward more data and more modeling on their issues. At the federal level, we continue every single day to put forward updated numbers to be fully transparent with Canadians on the national picture. But in order to have a national picture in terms of modeling and forecasts, we need to draw on what the provinces are doing, what modeling work they're doing. Provinces have been releasing this week much more information around their models, and as we collate those and look at those and integrate those into a national model, we will have more to say in the coming days.
We recognize that people want to know how long this is going to last and what might be the number of deaths. Each day on the Canada.ca website, we are putting up data in a transparent fashion. We are collating data from throughout the country to have a snapshot of what's happening throughout Canada. We recognize that many provinces this week have shared models, predictive models. If we want to have a national model, we are going to have to collate the models, these predictive models from different provinces. And we will do this in the days to come.
That it would be in the coming weeks then at this point, and the Conservatives are calling for a daily question period with the return to Parliament. Do you support that?
I think it's extremely important that Parliament continues to do its work, particularly in a time of crisis. It is going to be extremely important that we gather to pass important legislation to allow Canadian businesses and workers to be helped by the wage subsidy. These are things that we're gathering for and working together on. I think that as we asked the Speaker a number of days ago, we should look at gathering a virtual Parliament. I think it's important that parliamentarians from every corner of the country, not just those within driving distance of Ottawa, should be able to weigh in on the working of our democracy. That's why we're looking at virtual models of doing that. In terms of my own engagement, I'm happy to take questions every day, and I'm happy to work with parliamentarians as I take questions every day, as I do here from media. But I'm also happy to work with parliamentarians to make sure that we're continuing to get accountability and get the measures right for Canadians. I believe deeply in our democratic institutions, particularly in a time of crisis, and I look forward to continuing to work with all opposition parties to make sure that we have working systems in place.
We recognize the extent to which it's important to have institutions in a democracy that work well during a crisis. So we are going to adopt a bill at the House of Commons soon to help workers with this wage subsidy. And we've asked the Speaker of the House of Commons to look at different ways that we could meet virtually. It seems to me a little bit unfair that only the parliamentarians who are able to come to Ottawa, who live close to Ottawa, are able to participate in our institution of the House of Commons. We would like to create virtual options so that all MPs can participate. We're going to continue our discussions with other parties. I'm very pleased to take questions from the media each and every day, and I'm also open to take questions regularly from other parties. We're going to continue discussions on this.
I know you're going to be talking about your modeling in the coming days, but from what you've seen, do you have any idea when the virus is going to peak nationally? And also, are you concerned about the virus coming in waves that Canadians are going to be dealing with for many months?
Excellent question, Tom. I think we are very much trying to figure out where we are on the curve within the various models. What is very, very clear is there are significant differences across the country in where various provinces are on their own curves. Overall, as a country, I can say we have reached the point where we are later than many other countries. So we have a glimpse into what is effective and what is working to bend those curves in other countries that we are doing now. Our social distancing over the past weeks and staying at home has been very effective. And regardless of the model in place, it is clear that the best outcomes come when there is maximal social distancing, as we are pretty close to doing right now, as we ramp up testing, because that's an important piece of it, and we're continuing to do more testing every single day, and as we do aggressive contact tracing to ensure that people who are possibly exposed are put into self-isolation. These kinds of things are what give us the best chance of getting there. We don't know exactly when we're going to be peaking, but we do know if we continue to do this, if we continue to keep the measures in place that we have right now, we will get through this much, much quicker. Once we are through this initial phase, we will then be in a mode until there is a vaccine, which could take many, many months, if not more than a year, to get to. We will be calibrating very carefully our behaviors as a country, as a society, as an economy, to managing the existence and persistence of COVID-19. Better testing, careful isolation of vulnerable communities, measures of gradually bringing back the economy will come. So if there are spikes, as the data and documentation tells us that we can expect, we are quickly able to adjust and react. So none of those spikes over the coming many months that are possible will be anything as serious as this one. But in order to do that, we have to keep following medical advice, knowing that what Canadians are doing right now, staying home, keeping 2 meters apart, not going out unless you absolutely have to, is what is getting us through this and will ensure that that Canadians are kept as safe as possible and our economy comes back as quickly and as strongly as possible. So let's keep doing what we're doing. Just sur quel aspect? Le pic, oui.
Speaking about the spike, yes, we know that the measures that we are implementing right now are the correct measures. We've seen this with other countries who are ahead of us. We know that these measures are the best way to reduce the impact and the time that this pandemic lasts. We will continue with the measures that we have in place right now. We don't know exactly when we will have a spike in cases. We know that we will have a peak, and in the months and in the year to come, it is possible that after we go through this phase of the virus, we will have a resurgence of cases in Canada from time to time. I hope that we will have measures in place to better control these and also to reduce the impact of these spikes in cases in some places. This is why we're working together. We're going to share our models in years to come, in months to come.
Of testing for these models and numbers we're talking about, are you at all concerned that Canada's most populous province has the lowest per capita rate in terms of testing, but also, according to reports, is falling well short of Ontario's own testing goals? So what more can the federal government do? Why hasn't the federal government stepped in to increase testing in Ontario and in other provinces?
We're working very closely with all provincial health authorities to ensure that they have the equipment and the ability to do as many tests as possible. This is an essential part of getting through this phase of the pandemic and indeed keeping us out of further phase or minimizing further phases of the pandemic over the coming many months. We continually do more testing every single day in this country. We're already doing better than many countries in the world that we compare ourselves to. But at the same time, we recognize there's more to do. We will continue to work with jurisdictions that are facing challenges, and we will work together to make sure that we're doing what is needed right across the country to keep Canadians safe.
Prime Minister Janet Silver, Global News. Public Health Canada told the government in early February more resources for local public health officials were needed to contain the outbreak and enforce a quarantine order. Why did the federal government not act at that time to do more to bolster resources and to stop the spread?
We recognized early on that this was a challenge, and we did take many measures to try and control or prevent or ensure that Canada was less vulnerable to the spread of COVID-19 that we were seeing elsewhere in the world. With hindsight, I'm sure there are lots of things that we would have done differently, could have done differently, but I can tell you that every step of the way, we took the advice of our medical professionals and our public health experts seriously and did as best as we could. Obviously, once this is all through, there will be many people reflecting on different countries' responses and what we need to do to ensure that we are even better prepared next time. It was something we certainly did and benefited from because of the SARS outbreak of 2003 that allowed us to have a number of measures in place that were more effective than some other countries. But at the same time, there's always more to learn and more to do.
And an Ipsos poll is out today for Global News that shows 1/4 of Canadians report they are still not strictly following physical distancing. And cities are also logging thousands of complaints from residents about people flouting the rules. I'm just wondering, do you have any tools that you're willing to use to crack down on these people?
I think one of the things that we have to recognize in this situation is that much of the ability of Canada and of Canadians to get through this in as short amount of time as possible and as healthy as possible requires citizens to be doing their part. And we see millions upon millions of Canadians following the instructions of Health Canada officials, of their public health officials, in terms of social distancing, in terms of staying at home, in terms of not going out unless they actually have to, absolutely have to, of doing everything they can to keep our frontline workers, from grocery store cashiers to surgeons, as safe as we possibly can. These are the things that Canadians are doing. Unfortunately, we do see that there are some people who are not choosing to follow these instructions, and they're putting everyone else at risk. And we continue to impress upon everyone that we need to do what is necessary to get through this as quickly and as safely as possible. We will continually work with jurisdictions, with cities, with provinces on new measures or extra measures that they feel are necessary. As it goes, we're continually monitoring what is needed and what we might need to do as next steps. Merci tout le monde. Bonne journée.
And that concludes Prime Minister Trudeau's address to the nation. Definitely running out the clock there. And a few pieces of information to get to. He expanded the rules surrounding the wage subsidy program. Let's bring in Mike LeCouture in Ottawa. And let's start there, Mike. What do you make of what he said? We were talking about this before the address, not just from us, but also a lot of pressure. Certainly he's heard over the past few weeks to relax the rules a little bit, because to prove 30% loss in revenue is significant. So recap exactly what he said in terms of how this is going to make it a little bit easier for a lot of people.
Yeah, and he'll try and make sure that that gets down to 15. I'll just pull it up here as I was sort of going through it. So yeah, making sure that those rules now, businesses will only need to show a 15% decline in revenue for March instead of 30%, because a lot of businesses were saying, look, it's going to be very difficult for us to do this, considering where margins are, and needing to sort of. There was a lot of criticism of this too, not only from opposition parties, but there was also criticism from business councils. So obviously, this is going to be welcomed. We know that the Canadian Federation of Independent Businesses has welcomed this. They already had a statement based on some of the reporting we had heard yesterday on this. So they're happy about this. And, the Prime Minister admitting that, look, we tried to get this out the door quickly. And there were a number of questions on it. And I'm not faulting any of my colleagues on Parliament Hill for those questions. But the fact remains is that there were a number of economists and business organizations that all said at the beginning of this, weeks ago, don't get it right, just get it out. And that is what this government has done. And now, of course, even he admitted in hindsight, what we have done differently, perhaps some things, perhaps other things. But at the same time, he said, we were trying to get money in the pockets of people as soon as possible. And yes, there are gaps, there are student gaps. He had mentioned some of those today. Summer jobs program, we'll be making changes to that. And saying that, there will be the possibility of 100% top up on wage subsidies for the summer job program. And so the government is now, they rolled everything out, they saw the gaps, and now they're trying to patch them up. I don't think you can really fault them for that, to be honest, because they were trying to get things out the door as quickly as possible. And keep in mind that what we had said yesterday, ordinarily a program like this would take 1.5 years to roll out. They've done this in under a month. Now, yes, there are gaps and there are issues, and we are hearing reports from people, and even during this broadcast, I'm getting messages from people on social media saying, I've already gotten a payment from the CERB. Some people saying they're getting double payments, so that might be an issue that they run into. It's already in their account. Probably shouldn't be spending it right away, just in case the government comes back at you and says we need to claw some of that back. But I think in terms of what they announced today, and a lot of the questions centering around whether or not it was the right option, I think they're seeing where the issues are and they are trying to fix them now. And it's a difficult thing that I don't think any government has ever had to try and navigate at this point. And they certainly are learning a lot as they go along, Anthony.
No, it is a massive task. And you mentioned the students. Just to give a quick sense of where we're at on that, the Prime Minister was mentioning that changes to the summer jobs program, allowing the students really to be rehired and offering a subsidy of up to 100% to cover the cost of hiring students, which should help, because there are a lot of people, as you know, students were putting their hand up saying, well, what about us? And you wonder, and I can't help but think, what's next? We talk about the gaps, and day by day, it continues to change. I wonder what is going to be the next thing, who else is putting their hands up, and whether the government will respond. Do we have any sense of where those gaps might be?
Not at this point. I think that they're trying to sort of navigate this as they go and see who is putting up their hand next. Definitely there would be people who are possibly in sort of freelancers, let's say people who are, non-contract or on contracts that are seeing their wages dry up and don't feel like they can actually apply for some of these EI benefits. Those are some of the workers that they'll probably look to next. I think what the government was trying to do is looking at the greatest proportion of Canadians that will be affected by this, who is being affected right now, and who can we get the money to right away. Keep in mind, and again, I'm not trying to make any excuses in trying to defend this government. That's not my job as a reporter on Parliament Hill. I hold them to account. But I think we also need to look at what has been going on. You have had, as he mentioned, civil servants who are going through the same things that everybody who's watching this, you and I, Anthony, are going through. They are dealing with this as well, and they have been rehired to try and get this money out the door. They're doing the best they can. They're doing a pretty decent job if you consider that there are already well over 3.6 million of these claims that have been processed since March 15th. And so they're trying to get this done as quickly as possible. It is getting out there. The money's getting out there. Maybe it's not perfect yet, but it will get done, and there will be gaps. And the Prime Minister has said this a number of times. We're seeing the gaps. They're being identified. They appreciate that they're being identified because there are things that potentially they didn't notice at this point. So they're trying to make it up as they go along, really.
Yeah, a lot of people who are waiting for that money, and they're still waiting and waiting for some weeks now. They're not exactly necessarily in the forgiving mood. Some might understand the circumstances. Obviously, it's a huge Herculean, is how the Prime Minister addressed it. But nonetheless, it's going to be some time to come. We talked about testing as well, and he was asked about this, how Ontario is really falling behind. When you think of how many people in the province, it should be the other way around. Talk about that and really where Ontario is in the lack of testing and how troubling it is, because the latest numbers I see, about 5,600 cases, is that correct, if I'm not mistaken? Maybe I could be corrected on that. But nonetheless, if you shed some light on that.
Yeah, and he addressed that because he was asked that the most populous province is not seeing the level of testing per capita you maybe see in other places. And I think that's one of the difficulties that the federal government, frankly, is facing, and especially when the Prime Minister had mentioned, it was well over a week ago, saying that the Canadian modelling numbers will be released. And I think perhaps he promised that and realized, well, maybe we don't have everything. And he had mentioned as well that the way that they count them is a lot differently. I've said this before. Quebec is putting presumptive cases in with confirmed cases, so that's why their numbers maybe look a little bit inflated. But the Prime Minister is really letting all of them, because health is a provincial jurisdiction, letting them all do it on their own. So it's really not in his hands at this point as to who can be testing more. But he did underline the fact that what he has seen and what we've seen in other countries, because we are a little behind other countries, we've seen it, it started in China, then washed over Europe, and then came to North America. And the Prime Minister says that's a bit of an advantage that we have at this point. We can see what's happening in a lot of these other countries, not to emulate, but at least to see where they're going wrong and where maybe we should go right. And he was underlining the fact that the physical distancing is something that is consistently being said by health officials in every country that needs to happen. And he says that we're at this, not to say extreme physical distancing, but this very stringent physical distancing that Canadians are having to deal with now. He said the testing is key as well. Quebec has a lot of testing going on right now. They have been ramping it up with drive-through clinics. Ontario not doing that as much. But the problem is that the feds really have to leave it to every province to handle it. I mean, you even look out in BC, and I know we've talked about this a little bit, but Dr. Bonnie Henry, the chief medical officer there, continues to say, it seems like we're bending the curve. And at the same time, that messaging has to be, we might be bending it, but don't ruin all of this good work that we've been doing by running outside and saying, okay, it's over, because it's not. The Prime Minister mentioned that as well, with a second spike that could be coming, and saying that we really have to sort of unleash the economy, and we have to really sort of relax all of these measures slowly. And I think that was another thing that stood out for me, was that he had mentioned, look, a vaccine, which is the thing that will kill all of this, that will be the semi silver bullet in all of this, is still months, and he mentioned possibly a year away. So get used to some of these things, everybody. You have to make sure that you understand the physical distancing will continue for some time. And he said the normal that we'll get back to will not be normal. That was another thing that really stuck out for me, understanding that it's still going to be very different when we get back to whatever normal will be. And he is very cognizant of having to try and make sure that the economy gets rolling as soon as we can, but making sure that when that economy gets rolling, that it doesn't ruin all the healthcare, considerations that we've had in making sure that we don't put people in danger, because that's one of the things. It really doesn't matter if we don't have the economy. Let's be honest. We need our health first, and then we can get the economy going, because that is the key. If you don't have a population because everybody is sick, then it's not really good to have an economy because there's nobody to work in that economy. And I think that's where the thinking is going on right now with this government is, let's take care of the pandemic now. Let's make sure we get through this outbreak. Let's get on the other side of the spike, as the Prime Minister have said, see what the other side looks like in terms of other countries as well, and then make sure that we are not making the same mistakes that they are.
Yeah. Just to I stand corrected. I mentioned 56. It's 5,200, a little more than 5,200 in Ontario. And when you're talking about the testing, Mike, just to give you some context of where Ontario stands, this is from yesterday. 2,568 test results. But this is half of the daily target of 5,000. So you wonder if that is going to change. Obviously, a lot of questions. And he was asked about this as well. About, could we have been better prepared? The Prime Minister acknowledges, his words, could have, a lot of things we could have done differently, would have done differently. And there are obviously a lot of lessons out of this. They will certainly emerge. Perhaps now is not necessarily the time. It's hard to see it all when, you have to wait for the smoke to clear. Fair to say, and it's tough to do that when the flames are still raging. And you wonder where things are, because, look, we had these other examples in these other countries. Why wasn't Canada better prepared in terms of the stockpile, in terms of the testing, in terms of the testing kits? A lot of questions, and now you see day by day the Prime Minister is facing those questions, aren't they?
Yeah, and Patty Hajdu, the health minister, had mentioned at least a week ago, basically saying, look, successive governments have not been stockpiling these personal protective equipment shipments anywhere. Nobody saw this coming. You had SARS that we're all learning from, and I think that that's what the Prime Minister is also mentioning now, saying, look, we will learn from this and we will understand that potentially we need to have that stockpile going forward, and we need to be better prepared. But of course, hindsight, I think, is like what a lot of governments are looking at right now and saying it is 2020 because nobody saw this coming. And I think that Canada maybe should be also measured against other countries and whether or not other countries were better prepared or how they reacted, because I think that's eventually what will happen. Everybody will sort of take stock of this at the end of it and go, how did we react? Were we better than other countries? What did we learn from other people? And certainly there is that information sharing. Let's not forget, that you have researchers in China, researchers in Germany, researchers all over the world that are sharing information because it is a global fight at this point. And I think to your point of whether or not, there will be lessons learned, I think every country will have lessons to be taken from this and reacting differently going forward.
Yeah, global gut check going on, certainly. Mike, thank you so much. We'll leave it there for now. Let's bring in Mercedes Stevenson, who joins us also from Ottawa. And we're, take a closer look at some of the help that was announced, the relaxing of the rules, and new information surrounding students. Where do you want to start, Mercedes?
Yeah, so Anthony, I think, first of all, that business part is huge because a lot of businesses were saying that if they had to meet a 30% drop in revenue, they would no longer be sustainable. So the wage benefit wouldn't help them because even with that 75% supplementation of employees' wages, it would not be enough to keep them afloat because they couldn't afford to pay off their basic costs, things like rent, things like supplies, things like other debt that they're carrying on equipment. And so there was a real concern that was simply too high. The government heard that concern, and you saw that it was slashed in half today, down to 15%. Also loosening the rules for charities, saying that they can choose to exclude government support they've received to show a drop in revenue. So that would mean they'd only have to show the drop in donations rather than some who have been receiving government support, and it may not quite add up to that 30% originally and now 15%. Charities, of course, right now are vitally important because a lot of Canadians are without work. And that will continue to be the situation for the foreseeable immediate future. The economy, everyone hopes, will recover, but we don't know how quickly that will happen. So there'll be a lot of demand for services from those kinds of organizations that are providing not only charitable help in terms of things like food banks or places to stay, but also counseling services for people who have been traumatized. We've heard a lot about domestic violence in this situation and violence against children as well, those kinds of services. So to make it easier for them to be able to do their jobs, and especially in the immediate short term for organizations that work with people in precarious housing situations or who are homeless, we're telling people to stay at home and to frequently wash your hands and use hand sanitizer. Well, if you don't have a home, that's a very difficult thing to do. So those organizations are really scrambling not only to help those who were already homeless, but to help people as well who are at risk of being in that situation because of what has changed financially. A lot of Canadians live paycheck to paycheck, and if they don't have that income, they may not be able to stay in their homes in the immediate term or over the next few months as this pandemic goes on. So I think that was the government recognizing that they've heard the concerns of businesses, they've heard the concerns from the charitable sector. Moving to students, because I've gotten a lot of emails from students who have summer jobs. They're very worried because those jobs have now been canceled. And as the Prime Minister said, young people don't have the opportunity to have saved the money that other people do. They haven't even had the choice to make those kinds of savings when possible because they're just starting out into the workforce, and those jobs are important for them not only to pay their immediate bills, but to be able to pay for their tuition in the fall. And many are already carrying significant student debt. So what he was announcing there is that the federal government will subsidize the wages for those students who were hired for the summer. They will pay those wages in full to try to get those companies to make sure that they retain those students on so they have some form of financial support there. He also hinted there's support coming for seniors. I get a lot of emails from seniors, literally sometimes dozens a day, people who are saying they either worked part-time to help supplement their income and that job is now gone, or those who aren't able to work anymore, they're retired. Many can't come out of isolation because they have health conditions that would risk exposure. And their concern is that if you don't have a pension in your job, you've likely saved your money by investing it. Those investments have crashed. And now suddenly all these savings that they carefully put away are gone. And they're very worried about that. So you heard the Prime Minister promising yet again today that they will do more for vulnerable seniors. We just don't have a sense of what that is yet. And one of the interesting political pushes right now, Anthony, has been from the NDP. They want the government to go to something called universal basic income. And that would essentially mean that everybody gets insured a certain basic income. It's not something the government has been willing to consider. It would be a huge program that would cost billions and billions of dollars. But the government is sort of stuck in the situation of, on the one hand, trying to ensure that they're able to help those who need help. On the other hand, saying we can't cover off absolutely everyone. But you can see that increasing push from folks who keep saying, well, I fall between the cracks. And the NDP says the easy solution to that is just to make sure that everybody gets a basic amount of money. Of course, there's very serious financial implications for that because you'd be talking about potentially millions and millions of people who would qualify for that kind of a program.
And billions of dollars. I mean, it's hard to even imagine what the tab at the end of this will be, because this is a fight that, look, I think the whole country will be in for years to come, not just in terms of the health recovery, but the economic recovery for so many people. And of course, before that can happen, when it comes to the wage subsidy, for example, you have to pass the legislation. And he mentioned the virtual parliament. Do we have any sense of what that would look like?
So Parliament has to come back to pass the wage subsidy, and that has yet to happen, and there's a couple of ways it could happen. The most likely I've been hearing is that they will use the same format they used last time, which is a limited number of MPs that proportionately represents the ratio that party holds in Parliament. But the other option for that, or going forward in the longer term, which is what it sounded like the Prime Minister was talking about, is a virtual Parliament. Now, a virtual Parliament would break all kinds of rules that currently exist. So the Speaker would have to rewrite, Speaker of the House, all these rules to allow it to happen. But I do know that Pablo Rodriguez, who is the Liberal leader, government leader in the House, has been emailing, yes, but also writing, as everyone does now, the Speaker of the House to ask him what would the options be to be able to do a virtual parliament. And the reason why Mr. Trudeau is saying he wants to be able to do that is because it would allow for things like a question period. And one of the frustrations for a lot of opposition members and for many Canadians is that their duly elected officials cannot hold the government accountable right now in terms of asking daily questions. So the Prime Minister has been receiving questions on a daily basis from Canadian media, but not from elected Canadian politicians. And so the question is, how do you ensure that level of accountability? Because you can't just suspend the sitting of the democratic institution indefinitely, but at the same time protect against COVID-19. There's challenges there, though. How do you have a question period that also allows for access to MPs' computers and phones and doesn't create a security vulnerability? That's one of the issues that I've been hearing about from cybersecurity folks, that there's worried there could be security. There's certain rules that have to be followed, certain exchanges, that things happen differently in person when you're able to press versus over phones like I'm doing with you right now. But everyone else is also having to learn to live in a new virtual world. So the question is sort of, do they resume Parliament in a way that is the minimal number of people and in person, and perhaps you rotate, but then you have to find ways to transport different MPs in to make sure it's not just people who have proximity to Parliament that get to attend? Or do you look at a virtual Parliament, which might allow you to reconvene on a much larger level, but where you would fundamentally be changing some rules that have existed since Canadian Parliament first began?
So a cabinet meeting today, and also he mentioned that he will be effectively not leaving his home, still working from home, but at least being able to work outside his home from time to time. So that is at least some developments. This will be the first time since his wife Sophie Gregoire Trudeau was diagnosed. He also was asked about the projections. We heard the numbers coming out of Ontario, pretty grim numbers. Quebec, not much better. Alberta released theirs. Saskatchewan, if I'm not mistaken, will be releasing theirs today. And Newfoundland. Federal projections, whether they make a difference is the big question, but any indication on when those could come?
No, and they just kind of keep saying it soon, and they've been telling us that now for some time, and you could sense the journalists pressing there and the frustration, saying, okay, it was coming, then it was because they needed to get accurate data from the provinces. Okay, but if the provinces are now, sorry, I'm just taking down my low battery sign there. There you go. If the provinces are now in a situation where they're releasing the numbers publicly, then surely they're releasing them as well to the federal government. And they keep saying they need things that play into that. Number one, the provinces were measuring things differently, and that was a real issue for the federal government. Number two, they need the most accurate numbers, and that can be affected by the degree of testing. So, for example, Ontario has not done very much testing. So we don't really have a sense of how widespread COVID-19 is in Ontario. We know how many people have it, and there's a higher rate of people testing positive, but we don't have a sense of how widespread it is. There's been concerns that could affect the accuracy. But regardless, people are saying, look, you have to have some kind of federal projection. That is what Health Canada does. When do you expect this to peak? People want to know that information. They don't want it to be something that scares people or that lulls people into a false sense of stability of going, well, see, it seems like things are getting better. It's not that bad. But certainly there's pressure on the federal government to do this, as many other countries have released their numbers publicly for their overall federal expectations.
Okay, Mercedes, thank you so much for that. We are now going to bring in, or at least get to Deputy Prime Minister Chrystia Freeland.
And there's a real race.
She is speaking now from Ottawa. Let's listen in there.
But when it comes to the masks, we had the statement from 3M on Monday. The masks crossed the U.S. border into Canada at around 11:20 p.m. last night. They are here, and we are working as quickly as possible to get them distributed around the country to our heroic healthcare workers who need them so urgently.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you, merci. The next question is from Kim McCrail from the Wall Street Journal. Your line is now open. La parole est à vous.
Hi, thank you. This question is for the Deputy Prime Minister. Can you tell me, would Canada consider support for President Trump's proposal for imposing tariffs on oil from Saudi Arabia if talks between OPEC countries break down?
Canada is very engaged in collaboration with the United States at the G20 level as well in working on the situation in the global oil market. The federal government is working very closely on this with the province of Alberta and with Premier Jason Kenney, who has been really personally engaged as well. And our Energy Minister, Seamus O'Regan, and the Alberta Energy Minister, Sonia Savage, have been very involved. All of us have been in close touch, particularly with our American partners, because of the integrated nature of the North American energy market and North American energy production. And we are obviously also working on it at the G20 level and with other global oil producers. I think Canadians all appreciate that some of the actions by Russia and Saudi Arabia have had unfortunate consequences on the global oil market, and that's something that, working collaboratively, we are seeking to ameliorate.
Follow up.
Thanks. Yes, thanks. Can you speak specifically to the question of tariffs? Are tariffs on oil from Saudi Arabia something Canada would consider supporting?
I chose my words carefully. We are very focused on this issue. It's an important issue for Canada and the world. We are working closely. The federal government is working closely with the province of Alberta on this. The province of Alberta is quite correctly very directly engaged and involved. And
that is Deputy Prime Minister Chrystia Freeland. You can continue watching that on globalnews.ca. But here is a quick recap of what the Prime Minister announced today. He mentioned changes coming to the wage subsidy program. Companies can now use January and February as reference points to show a 30% decline. And you can also show a 15% revenue decline in March. So negotiations continue as well with the opposition over the wage subsidy bill. Some movement on that we need to follow, of course. The Prime Minister will attend this afternoon's cabinet in person, ending self-isolation that has been in place for a number of weeks. Changes also coming to the summer jobs program. The government will now give CSJ employers a 100% subsidy. So that is it for us. Thank you so much for watching. I'm Anthony Robart. That concludes our special.
Seeing another Phoenix take place as some fear? Answer. Thank you for the question. Two very important things. First of all, the system is working surprisingly well. Of course, we had prepared, the government and the public servants have worked very hard to make sure the system did work well. And we did want to make sure that it was going to be operating properly. So CRA and Service Canada employees are ensuring that we receive and process a number of applications that are about 25 times the normal level of what we would be receiving and processing, rather. Secondly,
dans la plupart des cas,
the system
dont je suis au courant, les gens qui ont reçu deux versements ont reçu un versement rétroactif.
So some people received retroactive payments too, because the CERB is retroactive to March 15th.
Un paiement
and then there's
d'avance, appelons-le un paiement prospectif, à partir du 11 avril, puisque le premier versement couvre la période du 15 mars au 11 avril. Maintenant, s'il y a inquiétude ou incertitude, c'est absolument important de faire preuve de grande prudence. Les gens doivent comprendre et savent déjà que c'est 2 000 $ par mois. Alors, c'est 2 000 $ par mois avec lequel il faut budgéter, indépendamment de si ou non on a eu un paiement d'avance, comme dans le cas de certains Canadiens qui ont reçu 2 fois 2 000, à nouveau une fois pour la période du 15 mars au 11 avril et une autre fois pour la période qui commence à partir du 11 avril.
Pour ce qui est de la subvention salariale, M. Duclos, le fait qu'il y a des négociations qui semblent s'étirer entre le gouvernement et l'opposition, on ne sait toujours pas à quel moment le Parlement va siéger pour l'approuver. Est-ce que ça va retarder l'entrée en vigueur de ce programme qui est très attendu?
On sait à quel point, comme le disait M. Trudeau ce matin, les deux programmes, la
the Prime Minister was saying this morning, we know that both programs, both the wage subsidy and the emergency benefits, are programs that are complementary. This week, we saw how essential the emergency benefit was, since we've already received 4 million applications, and many of those have already been processed. But we know that the emergency wage subsidy is also very important, which is why Mr. Trudeau and the House Leader and all the ministers around the table are working very hard with the other opposition parties to ensure that Parliament can be recalled to pass this important legislation as quickly as possible, which is absolutely essential to ensure that the wage subsidies can go forward. Could you repeat the answer in English,
on the first question, for all Canadians, and the issue is very important. It's a two-sided issue. The first one is that the Canada Emergency Response Benefit, not only we knew it would be important, but we now have the confirmation that it is absolutely important for millions of Canadians. And the good news here is that the system is working due to the hard work of a large number of public servants. The second thing that we need to be mindful of, that all Canadians want to be reminded of, is that this is $2,000 per 4 weeks. So there are Canadians that have received a retroactive payment dating from March the 15th, because that's when the benefit can be applied. So from March the 15th to April the 11th is the first 4-week period during which a $2,000 payment would have been made maybe yesterday or perhaps today. So that's $2,000 for the first payment. Some Canadians have already received a $2,000 for the second payment of 4 weeks, which is starting on April the 11th. But let us be very clear. It's $2,000 per month. So if people have received 2 payments, one retroactively and one prospectively, everyone needs to manage his or her budget on the understanding that it's $2,000 per month, regardless of when that $2,000 is actually deposited in his or her bank account.
Thank you, Minister. We'll now switch to the room, starting with Julie from CBC.
Yes, I'm just wondering about the wage subsidy, and it's either, I guess, maybe for Mr. Duclos. Businesses are really waiting for this wage subsidy. Obviously, you need Parliament to pass it. Air Canada applying for it today. What is the fastest, assuming Parliament gets going here, that they can have this money? I think the Prime Minister said something about 3 weeks. I think the opposition says 6. Is there a concern that many businesses won't be able to hang on?
Well, Minister Morneau has highlighted a very strong economic plan, which very briefly has 3 legs to it. So first is secure workers. Second is to secure liquidities. And second is to secure the ability of businesses to keep paying their workers. So on securing workers, that's the most important objectives of the Canada Emergency Response Benefit. Securing liquidities with the Canada Emergency Business Account, which is right now, as we're speaking, allowing businesses, in particular small and medium-sized businesses, to access a $40,000 emergency loan with no interest for the next 2 years. So that provides urgent liquidities to secure businesses so that you can count on them. And the second thing is the emergency wage subsidies. So these emergency wage subsidies, that important program is being implemented in different ways. First, in terms of legislation, and that's absolutely essential to do because it does require, as Prime Minister Trudeau said yesterday, important legislative changes on which we're working with opposition parties. And the second thing is that while we do this, we obviously are preparing the public service for the delivery of that important wage subsidy. But of course, the actual delivery must wait for the decision, as a democracy requires a decision of Parliament.
Explain then maybe in a very simple way, what is the hold-up? Why isn't the House sitting right now to pass this?
Maybe I will speak to that. As Jean-Yves has explained, this is a very significant program. We think that it is the largest economic measure a Canadian government has ever put forward. For that reason, we believe that Parliament needs to have its say about it. We're a parliamentary democracy, and that element of parliamentary oversight is crucial. House leaders from all parties are negotiating right now for how Parliament can come back to debate this legislation. And we very much hope that will happen quickly, and we very much hope that legislation will be supported. As you said in your question, Julie, this is support that Canadian businesses urgently need and that Canadian workers urgently need so that they can keep their jobs and keep food on the table. So we're working very energetically with the opposition parties to bring Parliament back. That's an essential step, and I'm hopeful it will happen really soon.
I'm being asked for you to please repeat that in French.
Repeat it in French.
Subvention des salaires est une mesure très forte du côté
de
notre gouvernement. Nous pensons que c'est la mesure le plus forte qui ait été jamais prise par un gouvernement canadien. À cause de ça, c'est absolument approprié, c'est absolument nécessaire pour le Parlement d'avoir l'opportunité de considérer cette mesure. En même temps, nous comprenons l'urgence.
We do understand the urgency of the measure for Canadian businesses and for Canadian workers to receive this support from the government. That is why the leaders of all the House of Commons political parties are working extremely hard. I worked very late last night with House Leader Pablo Rodriguez about this work.
Organiser le retour du Parlement pour considérer
Which
cette
is required
mesure.
To recall Parliament to consider this measure.
Aura la bonne volonté de tous les partis politiques. Je pense que tous les Canadiens comprennent l'urgence de cette mesure. Et j'espère qu'on aura l'opportunité d'avoir un débat et de voter sur cette mesure très, très vite.
And to move very quickly on this measure. Thank you.
I'm Mackenzie Gray from CTV. Dr. Tam and Patty Haidu, this question's for you to start. You both said over this period of time that testing is a very important part of coming to a conclusion of the pandemic. When we take a look at Ontario, yesterday they only tested about 2,500 people. That's below the daily goal that they got of 5,000 tests. Are you concerned about Ontario's testing level? And are we withholding tests or not testing as many people as we could because we're concerned about a lack of test kits in the country?
Maybe I'll start with the last part of the question first, and then I'll turn to Dr. Tam to talk about how testing strategies are created with the provinces and territories. And the short answer is no, tests aren't being withheld. The testing strategy that Dr. Tam has worked out with her counterparts across the provinces and territories is really to, first of all, get to the volume that we need to assure that we have a good understanding of what the disease presentation is in Canada, but also target it so that we are using the tests in the best way to actually determine the hot spots that we see across the provinces and territories and the risk of the disease in vulnerable populations. So I'll turn to Dr. Tam to speak about Ontario particularly, and anything else that she'd like to add.
Yes, different jurisdictions do have different laboratories testing rates, if you like, so the number of tests per capita. And that might be as a result of where they are in the epidemic curve. But I do agree that we need to increase our laboratory testing in Canada writ large, but certainly for jurisdictions that experience the most activity. So what we're doing is not just providing a consensus on guidance on who to test, but really looking at every stream of testing capacity, whether it's PCR testing to increase that. I know Public Health Ontario's laboratory is trying to improve that as they're going along, and we're there to help as much as possible. And getting the reagents and getting all of those supplies to the provinces and territories what we're focusing on, but also testing some of the newer capabilities like the nearer patient tests. That might be important for different areas of Ontario. Of course, Ontario is a very big jurisdiction. And so we're working really tightly with the provincial laboratories, but it's really, again, it's a bit like other supplies. We're pulling out every stop to try and get as much testing capacity as possible in Canada. But there is definitely variations in terms of lab testing rates across the country.
My follow-up is for Deputy Prime Minister Freeland. Over the past week or so, maybe 2 weeks now, the New York Times, Bloomberg, the Washington Post have all reported that China has underrepresented both the infection rate and the death rate. The U.S. government has also said that they have intelligence that says that they have done that as well. We asked the health minister about this. She said that there is no indication that the data that has come out of China in terms of their rates of infection and their death rates were falsified in any way. So 2 questions for you. As a Five Eyes partner, have we seen any of the intelligence that the U.S. has that says that China has falsified any of this data? And personally, do you believe the numbers that China has put out around COVID-19?
So let me start by talking about our collaboration with the WHO. This is a global pandemic, and Canada absolutely understands that a global response to it is essential. The multilateral organization charged with coordinating that global response is the WHO. And when it comes to data from various countries and when it comes to the multilateral effort around that, the WHO and our own health experts who work closely with the WHO are where we turn. Having said that, Canada is a very energetic member of the Five Eyes, and we have a close and very important security and intelligence partnership with the United States in the Five Eyes, in NATO, and in NORAD. And so, of course, we do share intelligence information through the Five Eyes. The Five Eyes are charged with doing that. And we have very frequent security and intelligence conversations with the United States. A reason that we are able to have those conversations, which are very important in the crisis that the world is experiencing today, is because those conversations happen in private. And so I am not able to share details of what is discussed in those conversations.
Good morning, guys. So let's talk about non-COVID patients. I've been hearing of major surgeries that have been postponed, not just elective, like cancer surgeries. And doctors that are healthcare, clinic doctors who are deferring people until a later date once this clears out. But if this takes months, what implications is that of deferring our healthcare until this clears up in the future?
So I'll start, and then I'll turn to Dr. Tam for obviously the work that she's doing with her colleagues. First of all, I want to thank all of the healthcare practitioners across the country who are making these very difficult decisions about which procedures to postpone, how to manage clients or patients that are ill with a variety of severity of illnesses, including mental illness, by the way, which is another area that we haven't talked a lot about. But in fact, patients are having a hard time accessing professionals in the area of mental illness as well. These are difficult times, and these are difficult, heart-wrenching decisions, and they are not taken lightly, I know, at any level of decision-making, whether it is provincial guidance that is being provided through ministries of health or at the local level as hospitals and practitioners decide how best to try to continue to treat patients while also preparing for a surge in a hospital setting. I do want to thank them for that hard work, because I know as much as Canadians are struggling and suffering and also postponing surgeries that for some of us might not think are essential, but of course are essential in their own lives, these are tremendous sacrifices. But also the healthcare professionals whose entire lives have been built around helping people in crisis and are now struggling to do that. We owe them a debt of gratitude for these difficult decisions they're making. Maybe, Dr. Tam, you can talk a little bit about the guidance that's provided at the national level for preparing for surge.
Well, I think it's a very dynamic situation in different provinces and territories, but what the chief medical officers are very seized with is not only trying to ascertain the impact of the actual public health measures that are sort of reducing the impact of the COVID-19 itself, but what are the other consequences that are negative consequences of our measures. And that is the area that we want to obviously focus on. I think everybody's attention right now is to get past that initial peak. So everything will be done, and whenever that is dependent on our action now. Everybody, I hope, has heard that message, is that right now is a really critical time for jurisdictions, provinces and territories that are looking at, well, when can some of this resume? I think they will be looking at, until you're past that peak, you can't really provide those kind of dynamic decisions. But that's exactly the kind of thing that they are looking at right now, is how do we resume some of these without impacting on the capacity to cope with the COVID-19 patients. But it's an incredible question, and one that everyone is on top of their minds for sure.
Thank you. And I just got a new one in, so... An Ipsos poll for Global News suggests 1/4 of Canadians reported that they are not strictly following the social distancing advice of public health officials. Cities across the country have also logged thousands of reports of people not following the rules. Do you have any tools left that you're willing to use to crack down on people refusing to social distance?
So at the federal level, obviously, we have certain jurisdictional responsibilities, and that's largely supporting provinces and territories in dealing with federal borders. And many of the tools that we have, we've used to varying degrees at varying times. And of course, we rely on the Special Advisory Committee of Public Health officials to talk about additional tools that could be imposed. But I think if you look at that statistic, what it actually says to me is 75% of Canadians are actually following social distancing. And of course, it's challenging for a variety of people to do that for a variety of different reasons. We continue to add measures and continue to encourage people to do that. And of course, at provincial and municipal levels, there are a whole bunch of tools being implemented, from fines to phone lines for people to call. And I think Dr. Tam's last answer is a very important thing to reflect on. The tools that we use have to be commensurate with the risk and have to be applied in a way that don't increase suffering in people's lives to the degree that have long-lasting impacts. And we can see that the world is in a difficult place. I mean, we're trying as best as we can to beat a global pandemic, a virus which there is no cure and there is no vaccine for, using, I would say, relatively primitive tools that have been used over centuries to prevent the spread of disease. So as we do that, and as we apply additional measures, we have to be extremely thoughtful about how we do that to get to the intended public health goal, which is to reduce the spread and to actually save lives, but also understand the long-lasting implications in other people's lives, and have some kindness and patience with people as they learn to live in a new way.
So I would look at this from two directions. One is supporting people to better social distance or to self-isolate. For example, we're looking at, well, do we need to provide some alternative accommodation for people who can't self-isolate appropriately at home? So working with the provinces, looking at that isolation plan. So if there are vulnerable people at home and they can't self-isolate, let's help them. So lots of these measures to help, maybe nudging and other tools. Apps are being studied in different places to see, well, how can we encourage people to know that they're not social distancing? You may have seen some of the Google work looking at, in fact, in Canada, many areas of Canada, we've really fundamentally reduced our mobility. Like in the sort of whole North American context, our province is at the top of the list in terms of reduction in mobility, for example. So those innovative tools tell us something about how our public health measures are working. Then on the other side, in terms of compliance relation to quarantine orders. So as we follow up people and check in on them, sometimes we find that we can't reach them. And we have tools to, of course, work with our peace officers to try and find them so that they will know that this is a really serious thing we're talking about. We've got a mandatory order on self-quarantine when you enter Canada, and that is serious, and we mean to look at compliance for that. So we do every day find people who haven't answered our phone calls and have to be chased down. And every province, every municipality are exercising some measure of that concept. But I think both, supportive wherever possible, I think is my take. But when needed, some of these fines and compliance measures are there for an added bit of a serious message, I think.
Thank you, Doctor. And I'll turn back to the phone for 2 more questions. And that's all the time we have for today. Operator?
Thank you. Merci. The next question is from Marie Vastel, Le Devoir. Please go ahead. Votre ligne est ouverte.
Oui, bonjour. Ma question est pour vous, Madame Freeland.
My
vous avez
question
dit
is
un
for
petit
you,
peu plus
Ms.
tôt dans
Freeland.
la
Earlier,
conférence de
you
presse que le
said during the press
Canada n'a été
conference that
privé
Canada
d'aucun
was
masque
deprived
par
of no
des
masks
compagnies américaines qui
by
exportent
American
chez nous.
companies
Mais
exporting
j'aimerais ça savoir
into our country.
qu'en est-il pour la
But I'd
suite.
like to
Est-ce
know,
que donc on doit
what
comprendre
about
que
the
tout
future? Are we to
tout
then
l'enjeu du
understand
décret de l'administration Trump sur les exportations
the
d'équipements
whole
militaires
issue
est
of
réglé?
President
Il y a
Trump's
une source
decree
de la
is
Maison-Blanche
resolved?
qui laissait entendre
The White
que le
House
décret ne
seems to
visait
be
aucunement
suggesting that the
les exportations
decree
vers le Canada. Pouvez-vous nous dire où
were
ça en est dans les
not
discussions et
applicable
si vous
to
avez eu des
exports to Canada.
assurances,
Can you
vous,
tell
de
us
l'administration
whether
américaine que
you
c'est réglé ou
received your
pas?
own assurances from the American administration that this
Merci pour
issue
la
has been
question.
resolved?
Et concernant les masques, je veux
Answer.
préciser
Thank
en
you for the
français, comme j'ai
question.
précisé
And
en
as
anglais.
to the masks, I will repeat in French as I said in English that
concernant les achats duquel j'ai des informations. Peut-être il y a d'autres informations au niveau des
that we've
provinces,
already
au niveau
made. I
des
do have
hôpitaux.
information about those. There may be other
Mais je veux
purchases by
aussi
provinces and hospitals that
vous assurer et dire
but I
maintenant
do want
tous
to
les
assure
provinces
you
et
and
tous
tell
les
you right
hôpitaux
now
que
that
le
all
fédéral est
tell all
ici
provinces and all
pour
hospitals that
aider
the
les
federal
provinces,
government
pour
is here
aider
to
les
help the
hôpitaux
provinces and
en
help
faire ces
our
achats à
hospitals
l'étranger.
in making these
On le fait.
purchases
Nous avons des ambassadeurs
outside the country.
excellents
We are
aux
moving
États-Unis,
ahead. We
en
have
Chine,
excellent
en tout le
ambassadors
monde.
in the
Et nous
US, in
travaillons en
China,
étroite
across the world,
collaboration
and we are
avec les
working in close
provinces, même avec
collaboration
les
with
hôpitaux
provinces and
spécifiques
even
pour
with
faire ces
certain
achats.
hospitals to make these
Concernant
purchases.
les États-Unis
With respect to the
et
United
la
States
question des achats des soins
and the
médicaux
issue of purchasing medical
des
supplies
États-Unis,
from the US.
c'est un enjeu que on est en train
This is
de
an issue
discuter,
we
de
are
régler.
currently discussing and
Tous
resolving.
les Canadiens savent maintenant
All
qu'on a
Canadians now
eu des
know
questions autour
that
des
we
achats
did
de
have
3M.
issues around the purchase
Mais
of the
on est
3M
en train
masks,
de régler
but
beaucoup d'autres
we are
enjeux
resolving many other
spécifiques.
specific issues as
Et
well.
je veux souligner que on a
I would like
eu,
to
on continue
emphasize
d'avoir
that
une
we have had and
conversation
are continuing
à
to
plus
have
haut niveau
a conversation on
concernant
several other
cet
levels
enjeu
with respect
avec
to
nos
this
partenaires
issue with our
américains.
American
On a
partners.
expliqué que concernant les
We've
soins
explained
médicaux,
that when
comme
it
dans
comes to
toutes les relations économiques
medical
entre le
services,
Canada et les États-Unis,
like
c'est une
all
relation
of the
vraiment
relationships,
réciproque.
various relationships
C'est
we
une
have with the
relation
United
dans
States
laquelle
is
il y
a
a
reciprocal
vraiment une
relationship. It is a
interdépendance.
relationship which is truly
Nous avons
interdependent.
besoin des États-Unis,
We need
mais
the
en même
United
temps,
States,
ils ont besoin
but at the
de
same time,
nous.
they need us
Nous
too.
avons expliqué ça et
We
nous avons
explained that.
Faire l'argument
And we
qu'une
made the
résolution
argument
gagnant-gagnant
that a
est dans
win-win
l'intérêt de tous
solution
les deux pays.
is in the interest
Et
of both
je
countries.
pense que jusqu'à ce moment-là, on a eu
I
de
think
compréhension du côté de nos partenaires
that we did.
américains. En même
That
temps,
we were
on doit
understood by our
continuer
American
de
partners and
travailler
counterparts.
sur
At
ça.
the same time, we have
C'est
to
un
continue
moment
to work
très
on this
difficile
issue.
pour tous les
It is
pays
a
du
very
monde,
difficult situation
incluant
for
le
all
Canada,
countries in the
incluant
world,
les
including
États-Unis.
Canada
C'est
and including
vraiment
the
une
United States.
crise et on doit
truly
faire
a
du
crisis,
travail
and
quotidien,
we
heure
have
par
to
heure, jour
work
par jour.
on a daily
Et
basis
c'est ce qu'on
and
fait. Et
on
je
an
veux
hourly basis and keep
aussi
working.
souligner l'importance
That's what
du
we must
rôle
do.
des
And I
premiers
must
ministres des
also emphasize
provinces.
how important
Nous
the
travaillons
premiers
sur
and
cet enjeu vraiment
provinces' role is.
comme équipe Canada. Et
This is an
nous
issue
aide
we are
beaucoup.
all working
Merci.
together on as Team Canada. Thank you so much. Quick follow-up question?
En question de suivi, je peux juste être
My
claire
follow-up
sur où ça
question
en est,
is
donc,
as follows.
s'il y a
I
eu
just
du
want to be
progrès
clear
depuis
where we're
hier,
at then.
outre
Was there
3M,
progress made made beyond the 3M
case. You said you're working on a case-by-case approach with various companies. So you said you're working on other specific issues. What does that mean? Does that mean that since yesterday you reached an agreement with certain companies to be exempted from the Trump administration's decree? And if so, how many companies and how many supplies? I do not wish to get into the details of specific cases, but I can tell you that up till now, we have managed to resolve the issues, and that we will have to continue to do that work. And that's quite normal. Trade relationships require persistent work. And Canada knows how to do that, and Canada will continue to do so.
We are pleased with the resolution of the situation with 3M, and we are delighted that the first part of Canada's order from 3M has been resolved and that those 500,000 masks are here in Canada. More broadly, we have been making the case for many days now to our American partners that when it comes to medical equipment and services, the relationship between Canada and the United States is truly reciprocal. We are dependent on one another, and both countries will be best served if we can continue to work together. That is the argument we have been making, speaking about some very specific examples of the role Canada plays in the U.S. medical supply chain, of the role that Canadian services play in the U.S. healthcare system. Thus far, we have been met with real comprehension from our American partners, both in the administration and also at the business level, because American businesses really understand the extent to which the supply chains are interdependent. This is work that is constant, and we just have to keep at it. And by the way, that is the nature of our trading relationship with the United States in general, that it requires constant work, constant gardening. And in this time of a true global pandemic, of a real crisis, it requires particular attention. And we are devoting absolutely that necessary attention to it.
Thank you, Deputy Prime Minister. One last question, operator.
Thank you. The next question is from Althea Raj from the HuffPost Canada. Please go ahead. Your line is now open. We're turning it web.
Thank you. I think my question is for Minister Trudeau or Minister Freeland. I'd like to know if Cabinet considered a broad-based universal payment approach as a way of catching all Canadian workers whose income might...
but also those that would not have been able to receive any support. So we are working in an emergency situation where we are in fact doing things that Canada and Canadians have never done. No, the EI system wasn't designed for that. So we have put into place a system at relatively high speed and with relatively good outcomes, where we see millions of Canadians being given emergency assistance in a context in which millions of Canadians need and demand that assistance. So we are demonstrating that when we work, as we work together, we're listening and inputting the advice of many people outside of the government. We can do great things in Canada and great things as Canadians, in particular, doing things that are quite universal in their nature at a particular moment.
Althea, it's Christia. I just want to add one point about the wage subsidy program and a particular advantage that it offers, and a reason that this was a program that we are really delighted to be offering to Canadians. The wage subsidy program offers, on top of the CERB, a particular benefit, and that is two particular benefits. First, it helps to retain that crucial link between employers and their job. That is absolutely essential psychologically for people to know you're not only having an income, but you have a job, and you have a job that is still there. It is also crucial in terms of the ability of businesses to keep going and to remain operational, and for us collectively, therefore, to be in a position to come roaring back economically when we are able to relax the essential health measures that are in place right now. So I would really like Canadians not to understate the value of the particular structure of the wage subsidy program. This is going to maintain that essential connection between people and their jobs, and it is going to help businesses remain fully functional and intact. It is a great program, and we all really, really hope that Parliament will come together soon to support this program and keep Canadian companies and the Canadian economy strong through this difficult time. Thank you.
Merci. Ceci met fin à la conférence de presse.